Welcome to the Bible, the Basketball, and the Briefcase podcast. I'm your host, Jay Martin, and I'm so honored today to have Dr. Charles Feild with us. Let me introduce you to Dr. Feild. Dr. Feild received his medical degree from UAMS and completed a pediatric residency there as well.
That was 100 years ago.
100 years ago. It wasn't that long ago, Dr. Feild. But he continued his training at the Hospital for Sick Children, Guy's Hospital in the United Kingdom. He also received a Master's of Public Health from Tulane University in New Orleans. Dr. Feild became a present assistant professor, associate professor, and professor of developmental behavioral pediatrics at the College of Medicine, associate professor and vice chair, maternal and children's health at the College of Public Health, and program adolescent children behavioral at the College of Medicine at UAMS as well.
No wonder I'm tired.
You did a lot, and there's I've got like a whole. I can keep going.
No. That's fine. That's fine. That's fine.
Two of the things that you did that I want to bring up because I think it's very relevant is one is you were a physician for the Little Rock School District.
Yes.
And you also, I think you consulted for Head Start.
I was the executive director, and when things went well, it was the UAMS Head Start program. When there was a problem, it was Charles's program.
I understand. Well, you've done a lot of good work, and that is a fraction of the things I could say about your background. But we'll stop there.
Let me say the most important thing
Yes.
about everything that you just
Yes,
said
sir.
was I loved what I did, and it was fun.
Yes.
And the committees I didn't particularly care about, emails and memos and this and that and committees, no. But the part of sitting down with a family and a kid and taking care of them, they were paying me to have fun.
I understand.
And so I went to work every day, and it really wasn't work. I went to play.
I understand.
And I got paid for the play part. The
Right.
other part I just had to do. But I got paid to have fun. And then they put money in the bank every month.
Absolutely.
And it was the most wonderful experience. I can't imagine doing anything else. I don't understand why anybody else would not want to be a pediatrician.
I understand completely. And one thing I failed to mention too, you're an author. You've certainly authored lots of academic articles and publications, but
hold it up because that one's for sale.
Well, I know that's what we're going to do. We have a link too on our website to this, and we're going to talk about this a little bit later. But this is Feild Notes on Little Rock: History and Memoir, 1622 to 2024. Dr. Feild certainly has published other things, but this is a fun book. And we're going to put the link up. I believe it's on Amazon. I got this at R Street.
Wordsworth. Yeah, let me plug. Wordsworth has it. Pyramid Books on Wright Avenue has it, and Paper Hearts, which is an independent bookstore in Petaway Village, over close to where you have your program.
Yep.
Also has it.
Okay.
And so I'm plugging my independent bookstore.
Absolutely. Partners. That's what I wanted to do as well. So, and we'll talk more about this in just a few moments, but we always start, Dr. Feild, it's the Bible, the basketball, and the briefcase, how an Arkansas lawyer also became an inner city pastor. And so we start with the Bible. And today the guy that helps me run this podcast, that actually is the producer, is Drew Fowler. And Drew, thankfully, owns a T-shirt shop, and so we were looking at and thinking about, okay, we wanted to do a T-shirt. What do we want to put on this T-shirt? And we thought, well, this is our mission. Matthew 19:14, Jesus said, "Let the little children come to me, and do not hinder them, for the kingdom of heaven belongs to such as these." So throw me that T-shirt, Drew. So we put our mission there. That's Matthew 9:14. I just read. And we'll show it to our viewers too. And then the back of it is the Bible, the basketball, and the briefcase podcast with the way that you can locate that on YouTube and find us there. But
well, thank you.
But anyway,
Thank you.
We usually do that at the end, but we'll do it at the beginning because
Yeah.
it was part of my talk today on the Bible. But I wanted to just talk about when we tried to figure out something to really capture what we're trying to do. Of course, 27 years ago, I started playing basketball with kids in the inner city when I worked for the Honorable Marion Humphrey as a pre-sentence officer. That sort of led me out there. And what we've tried to do since that time is really get involved in the lives of kids and their families. And so now this whole project, writing the book, this podcast, is to raise money to build a gym to the north of Metro, because we're also the basketball. We love sports, and it's a great way to connect with kids. So that is exactly what we're doing. And I'm bringing this up today because, ladies and gentlemen, here is a man who has dedicated his life to helping vulnerable children. I think the thing that I admire the most about you is you could have gone a different route with your practice, but instead you became a pediatrician to help the most vulnerable children in some of the same neighborhoods that we're in.
Exact same.
As a physician, as someone, an expert in public health, you have completely lent your career to making the lives of vulnerable children better. So I thought it was so appropriate. This is sort of dovetailed together with this talk. So thank you for the work that you've done. And let me tell you just a little bit as we begin our interview here of Dr. Feild. I met Dr. Feild through a colleague. I needed an expert witness, and I try very hard to not talk about any facts of the case. But it was an adoption case where foster parents, you remember the case, foster parents had received a child and fostered a child almost all of that child's life for over 2 years. The only people the child knew was these foster mom and dad. And they understood that if the child's parents' rights were terminated, which happened, that they would have the first opportunity to adopt the child. Well, a distant relative was found, and DHS decided to remove that child from the only parents that they knew and put them with these strangers to the child. So we found Dr. Feild. And I'll let you talk, Dr. Feild, about the work you've done with trauma. Dr. Feild came on as not only as an expert witness, but let me just say, first of all, a first-class expert. But then also, when you have an expert witness who says, "I don't charge for my services," that's incredible. But he loves children so much, and he said, "Let me review the case and make sure you're on the right side of this." But when he found out that we were, he donated his time as an expert and really turned the case. And then many more times, and very similar facts, we were able to work with Dr. Feild to make sure that that children were not removed from the only home that they knew. But I was just reflecting on that, and obviously we can't talk about any of the facts of the case, but just generally, Dr. Feild, I know that you were so helpful, and particularly, you might talk a little bit about the work you did with trauma and helping put together scales and ways to figure out how children, what it looks like whenever there is abuse and trauma, and the work that you did with that.
Okay, well, I saw that family in the last couple of weeks.
Oh, wow.
And the little fella is doing great.
Wow.
He's got adopted siblings, and they are a beautiful, beautiful family.
Wow.
And you probably haven't seen them recently, but
No.
You should be very proud of what you guys did.
It's a blessing.
So to talk about kids that have been exposed to trauma, we've known about trauma for a long time, and different kinds. That was battle fatigue in World War II, and then it became recognized that it was post-traumatic stress disorder, and that could be from witnessing violence to going through a tornado, through going through a car wreck at an intersection. There are all types of trauma. And then accidentally, it was discovered that trauma can have long-term effects, not just on mental health, which just sort of makes sense. You go through something bad, you're going to have bad memories, or something's going to remind you. There'll be a thunderstorm, and you're going to be deathly afraid of the tornado again. They were doing some research in California on a group of employed people with private insurance, and they were looking at factors that could predict risk for things that could be treated early or perhaps prevented if they were identified. And one of those things was people having been exposed to a traumatic event as a child. Sure, there were more terrible things, suicide, drug abuse, all sorts of things like that. But there was more diabetes, there was more cancer, there was more hypertension, there was more heart disease. And we had the opportunity to have the man that ran that study, Dr. Vince Felitti, in Little Rock and sit down with a small group of us at Children's. And he said, I didn't believe it. He said, I'm an adult physician, taking care of adults all my life. There's no way stuff years back when you were a kid could have anything to do with you as an adult. And I went back to my team and I said, do it again. You're missing something. And they came back and they said, no, the numbers are actually better now because we tightened up some things.
Wow.
And he said, I told them to do it again.
Yeah.
And he said, at that point, I was convinced this is real. And
so what you're telling me, doctors, is it doesn't just affect your brain, but it can affect your heart, it can affect different organs of your body and cause long-term physical health problems. Trauma can.
well, see, you're assuming we understand the brain.
I understand, right, exactly.
And the brain and the body.
Sure.
And the brain is just one more part.
Right.
And it all works together.
Yeah.
And some of that behind the scenes stuff, like, well, what does your brain have to do with rheumatoid arthritis or cancer?
Yeah.
They're starting to unravel some of that,
Right.
all the way down at the molecular level, which suggests ways to treat it at the molecular level or prevent it or detect it early. So stay tuned on that. That's going to be really important.
Yeah.
But they came up with the Adverse Childhood Event Study, which came up with the Adverse Childhood Event Survey, and it's a list of 10 items, which I'm not sure I can do these off the top of my head today.
Oh,
but
that's okay.
They're sort of they're no-brainers: incarceration of a parent, mentally ill parent, parent with health problems, witnessing violence, being a victim of violence, et cetera, et cetera.
Drug use, I think.
Yeah, but it's a nice total of 10 things.
Wow.
And they're yes, no questions. And if you have more than 4 things, you're very likely to have some kind of lifelong impact. And they can be psychiatric, they can be health as well. And the problem is that's so simple, it sounds too good to be true. And you and I have been there when the judge said, no, this is too good to be true.
Right.
And when the attorney for the state said, no, that's too good to be true.
Right.
Well, actually, it is true. And the concerning thing about that is the legal community and the judges, the judiciary not being aware of that.
Yes.
It's accepted. The annual training program that the Supreme Court sponsors.
Yep.
And I don't remember the name of that program, but they did a session from the Supreme Court to attorneys and the judiciary on how this is a real thing.
That's right.
And you and I have yet to encounter, you see it a lot more than I do, but I've not yet encountered any of these people that have any idea what we're talking about.
You're absolutely, you turn in sort of to the professor when you take the stand and as you talk about trauma and you talk about the scale.
Well, I am a professor.
You are a professor.
Which is an advantage.
It's very easy for you to turn into a professor.
I
should say you put that hat back on, I guess.
Yeah.
When you get on the stand.
And if they can find somebody else that wants to get up there and argue with me from the other side,
absolutely,
I'll be more than happy to have a discussion with their professor.
Well, they never have, though.
No.
So I think what really turned so many of these cases, Dr. Feild, was the fact that you were in a position to testify that removing a child from a stable home environment to a place they never know creates a point on the trauma scale.
Right. And the goal for Department of Human Services and the funding that drives that allows them to operate says that family stability, what's the placement with a family member
Yeah.
is best.
Right.
Except there is a but
Right.
in the part that goes with the funding and the part that goes with the regulations and the part that goes with compassion. But I think for a lot of these cases at the local level with Department of Children and Families stretched as thin as they are with the terrible pay that they're able to provide to people
Right.
and the absences that they can never fill, that it becomes not too easy, but it seems the right answer if you can check that box, family member.
Right.
And family member goes down to fifth cousins.
Right.
And I challenge anybody watching this podcast or
Right.
you or Drew to name a fifth cousin.
No.
At that point, your DNA relationship to that individual is minuscule.
Right.
And, families are not perfect.
Right.
Or you and I would not be working with these kids that are in foster
That's
care
right.
and are looking for an adoptive family.
Yep.
So the vast majority of the time, that is the best. I have seen families where I'm thinking of one person in particular, a step grandfather. He married the grandmother, and he was the last adult standing, and the child had special needs.
Wow.
And the child thrived with him.
Yeah.
Now, he also understood that he needed help, which is where he met me in the clinic.
Yep.
To know that this is a hard job.
Yeah.
This kid's got some stuff that we need to get him some special help. But when he got it, it worked. And he did everything that he was asked to do and suggested to do. And he was as good a parent as anybody this kid could have had. That was a blessing.
That's amazing
for both of
Absolutely.
them.
Absolutely. Well, it's just in the 5 or 6 cases we had together, the difference that you have made just in those families, the ripple effect through time and eternity, there's no telling the fruit that will be produced from those.
That's why you do pediatrics.
That's why you do it. That's why you do it. That's exactly. And that's a good segue, because I wanted to ask you, I know you've done amazing work with kids all your life, but let's first just discuss as a pediatrician. Tell the viewers, I know you've been a professor, you've certainly, you've done all kinds of different things with your medical degree and with your pediatric emphasis, but just as a pediatrician, just what have you done as it relates to treating kids?
Oh, gee.
If you can sum it up in 5 words. No, I'm joking. I know we're talking about an entire span of a career, but I know, but for instance, I know you saw them in the clinic. You were a clinical pediatrician, and then I think you may have done some work for children's where you might have helped with, with maybe some specialized things as well.
Well, very early on in my career, my boss, Dr. Bob Pfizer, called me in and he said, "Look, I need some help. We get calls from places and groups all the time needing some help. And we've asked the general pediatric clinic to take those on, and they do. But it always turns out that the day that they need somebody somewhere else, they're somebody short, or we're in the middle of an epidemic, and they end up just not being able to deal with it. They don't have a warm body." And he said, "I'm asking you to figure out how to get warm bodies to those people and still be able to make it work. In other words, to allow it to pay for itself."
Right.
And so part of that took me into learning how the funding for child health programs and child health systems and DHS and Medicaid. I became an expert in Medicaid for quite a while because that became the Our Kids program here that Governor Huckabee and Amy Rossi from Arkansas Children and Families and Dr. Gil Buchanan from DHS put together. And when Dr. Buchanan came into a meeting that evening and told us what they had just done, we laughed at him because we knew that could not have happened.
Right.
And it did.
Yes.
And it put us out in front of the country in the terms of number of children that didn't have any health insurance. We went
Right.
from about 30% with no insurance, and right now it's about, well, it's down some with some of the changes that have been made in Medicaid that I
Right.
don't agree with, but
Yeah.
we're still way up there.
Yes, sir.
One of the things that's a little bit different about me is I recognized, even while I was still in training, that our so-called healthcare system was full of holes.
Right.
And if there's a hole, the most vulnerable person is the one that's going to
Gonna
fall
in
in
that
it,
hole.
and they're
Yes,
going to
sir.
fall all the way
Right.
to the bottom.
Yep.
Somebody like you or me, if we hit a hole, we're going to find something to grab a hold of,
Right.
or somebody's going to reach down and catch
Pick
us
us up.
before
Yeah.
we hit the bottom.
That's right.
So it was hitting the most
Yeah.
needy in the worst way.
That's right.
And then I met and married a lady from Scotland, and I trained in London for a year
Right.
in the National Health Service. Yes, ladies and gentlemen, I was a physician in a socialized medicine system,
Okay.
and I saw how well it could work.
Interesting.
Number one, that huge group of people that do billing and collecting and insurance and this card and that card and this
Yeah.
form and that form, they didn't need that
Yeah,
because
interesting.
everybody was covered.
Right.
Now, having said that, the British took their eye off the ball for about 20 years. And then when COVID hit, it started to fall apart, and it's still falling apart. Their physicians didn't get a raise for 13 years in the National Health Service system.
Yeah.
And how's a law practice going to run if nobody?
Right.
Yeah.
Would be difficult.
Yeah. So, I mean, they basically starved
Sure.
it to death.
Sure.
But every other country's got some kind of, with the exception of South Africa, some kind of universal coverage for basic health care for everybody.
Yeah.
When people don't get as sick because they got a doctor, you don't have to spend as much money putting them in the hospital.
Yeah.
But if again, if you leave a hole, it's going to be the most expensive hole that sucks all the money away from the things that could be used for prevention and keeping people well. So anyway,
Sure.
So I had that different perspective, and very early on, I realized that I was treating ears and making kids fever go away. I was taking care of their sprained ankle. But in the long-term perspective, I wasn't really making a difference. There needed to be a village out there for me to be part of. So I started working with schools, and I ended up working with the Little Rock School District.
Next on my list. Second, I know that you also did work for the Little Rock School District.
Yeah, they had for decades had a school physician, and for decades, that person got to sit on the bench of the Little Rock Central High football team.
Oh, wow. That's great.
During games.
Yeah, right.
And then they decided during my lifetime that it would be a pediatrician. And so that started out just being an advisor on immunizations. And then it went on to someone else who got more involved. He was a younger pediatrician and a PTA president and a school dad. And he established a relationship with the nurses. And I just managed to take that to the next level because the nurse that was running the Little Rock School District was someone I had known since we were both in school together.
Oh, wow.
And so we'd known each other and we thought alike. And so I would visit the schools and the school health rooms and would meet with the nurses periodically, and they had my phone number, and they called me very seldom. Mostly because they were really good. But when they did, we were able to pull some things together more than they could do from the school or that I could do from a clinic. And when a kid's doing better in a classroom, guess what? The whole class is doing. And when that teacher's having an easier job, the principal's got an easier job. And that eventually morphed into a school-based clinic with a nurse practitioner partnered up with Arkansas Children's Hospital. And the first kid that we saw was, just as an example, and this was the very first kid, very first day, needed a prescription for some skin cream for allergy.
Wow.
Okay, well, that's easy. We
Yeah.
can do that. And then it transpired that the little girl had mental health problems and had not seen a therapist in a long time because they had moved
Yes.
and they hadn't been able to get on Medicaid. Well,
Right.
Children's Hospital can take care of
Yes.
they can make that happen right then and there.
Right.
And then it turned out she was tardy a lot because they didn't have a car and they were sending food home from the school for the family, but they didn't have any electrical power.
Oh, so they can't.
So
cook
they couldn't cook anything.
Goodness me.
And so that pulled a number of other things together.
Yeah.
And at the end of the day, that kid again had a chance.
Yes.
And she had walked into school that morning with all those things lined up against her, and she did not have a chance.
Right.
And parents had just, they had all the bad luck in the world.
We see it all the time.
Yeah, they had done nothing wrong.
Right.
They had a job and lost it. They had a house,
Yeah.
and when you don't get paid, you don't have the house, and so they had to move. And then, so and that was just in one day with one kid.
Yeah.
So that's the thing. That's where I'm going with this. Is in pediatrics, you can make a difference.
You can really make a difference. And now I don't know if you. Let me ask you this: did you get to go to the Central High football games and sit on the bench?
I went to one,
okay.
but I did not sit on the bench.
Right.
I sat with Max Brantley from the Arkansas
Oh
Times.
yeah. Okay. Well, that had to be
that was more fun than sitting on the bench. Yes, it was.
So,
he had a commentary.
I'm sure he did. I know you did some work with Head Start.
Yes.
Tell me about. Is that where I know you had this when kids come in foster care? There is a whole program that they get a health screen.
Yes.
Which they probably have never received.
Yes.
I don't know if this began at Head Start or something
separate.
separate.
That was separate.
Okay.
And my friend Dr. Eldon Schultz came up with that because kids were in Arkansas. Long story short, was about to lose a huge lawsuit because the foster care was so poor.
Yeah. And
you name anything that can be measured, and foster care in Arkansas was terrible. When was the last time this kid saw a dentist? Well, we don't have a record of that. Well, how long has he been in foster care? A year. So he hadn't seen a dentist in a year.
Goodness.
When did he have his eyes checked? We don't know. How's he doing in school? Oh, well, he's not enrolled in school, or he's failing. Well, why is he failing? Well, we don't know. So all the things that could be done to make it better that you have foster care for weren't being done.
Right.
And so part of the agreement was, and the state was at that time very grateful to have it, was my friend Dr. Eldon Schultz put together a program where kids would get an assessment with a physician, a school psychologist, and a speech pathologist, and they would get everything looked at: their academics, their hearing, their speech, their comprehension, their health care, their medical history, and sometimes the biggest part of that job was trying to be a detective and take little bits and pieces and try and figure out what the medical history was. The kid who had the scar all the way across their side, what's that for? Well, we don't know.
Right.
Well, the kid had a tumor removed.
Oh, wow.
And had an appointment in 2 years. Fortunately, the kid was in remission.
Oh, my goodness.
But it's a disease that can recur, and they needed follow-up, and they at least needed to know, if I'm going to put a child in your house that's had cancer.
Right. Yeah, you may want to know that.
And a scar.
Parent.
Yeah. So that was probably the biggest part of that, a lot of those days. And then the other time was, well, this kid's not learning because he can't hear, or this kid is having anger attacks in school because he's got a speech problem, and when he talks, nobody can understand him. And he gets tired of hearing, what, speak up.
Right.
And so eventually you lose your temper.
You do.
You would. I would. Anybody would.
Sure.
Well, not Drew, but anybody else would.
Yeah, Drew's pretty pretty tall.
Yeah. And so that program was very successful. Head Start was a different thing. Out of that, hey, Department of Pediatrics, we've got this situation we need some help with.
Yeah.
Well, the Head Start kids all were required to have, and at that time there were about 900. They needed to have a physical assessment within a fairly short period of time after the year started. And this was before our kids, so kids did not have a PCP.
Right.
They went here, they went there, they went to the ER,
Right.
they went there, they went to the ER, they went here, they didn't go anywhere.
Right.
And they had hired a physician from out in the community who 1 year evaluated 900 kids and nobody had a problem. Okay.
That's probably not possible.
That's not possible.
Right.
You know, you name very many pediatrics things, and it's
Yeah.
1 in 100. All right, well, you
Right.
got 900 kids.
Yeah, right.
Okay. So
Yeah.
we started doing those evaluations, and it was a partnership with Children's, and they're clerical people and they're Medicaid experts.
Oh, wow. Yeah.
Who were frontline got very interested in that.
Yeah.
And we found out a bunch of these kids that don't have health insurance, they actually qualify for Medicaid. It's just been too hard to get them on. Nobody bothered to put them on when they were in a clinic. You
Right.
don't do that in the ER. And so we got a bunch of these kids with health insurance now.
Wow.
And one kid had a seizure while he was being evaluated.
Yeah.
Every
Goodness.
hour or two, we'd listen to somebody, and the kid was wheezing, and he had asthma.
Oh,
And,
gosh.
you know, and on and on and on and on and on. So we ended up with about 20% of kids year in and year out that needed to get seen sometime in the near future.
Right.
And occasionally we'd send one to the ER. You
Yeah.
know, the asthma
Yeah.
was bad enough. The seizure got a ride in an
Right.
ambulance to go get
Yeah.
diagnosed and take back.
Come on, all the earth, raise a shout tonight, lift the name up high, make that praise shine bright, tell the world how great his word